Welcome to today's video on protein energy malnutrition. In this video, we will explore causes, types, symptoms, treatment, and prevention strategies of protein energy malnutrition. Let's dive in and understand why protein energy nutrition is essential for a healthy life. The main diseases covered are marasmus, kwashiorkor, and marasmic kwashiorkor.
Introduction. It arises due to insufficient intake of protein and calories, leads to various health issues impacting growth, immunity, and organ function. Most of its impacts are seen in muscles, liver, skin, and hair, and it is most seen in regions with high poverty rates, food insecurity, and limited access to healthcare. Nigeria, Ethiopia, Bangladesh, and India have more protein energy malnutrition prevalence. Types of protein energy malnutrition. There are three types: Marasmus, Kwashiorkor, and Marasmic Kwashiorkor. The classification is based on the type and degree of nutrient deficiency, primarily focusing on protein and calorie intake. In sense, Kwashiorkor is severe protein deficiency and Marasmus is severe deficiency of both protein and calories. Let's see in detail about marasmus. It is characterized by severe wasting of muscle and fat due to prolonged deficiency of calories and protein. Causes typically results from chronic starvation, poor feeding practices, or malabsorption issues. In this picture, we can see the typical symptoms. Symptoms include significant weight loss, extremely thin body, muscle wasting. Children often appears emaciated with a skin and bones appearance, sunken eyes, and a distended abdomen. Next comes Kwashiorkor. Unlike marasmus, Kwashiorkor is primarily due to protein deficiency rather than calorie deficiency. It often appears in children who have adequate calorie intake but insufficient protein. Causes. Kwashiorkor is often associated with high carbohydrate, low protein diet. The picture shows the following symptoms: swelling in legs, arms, and abdomen due to fluid accumulation, moon face, reddish hair or flaxen, and flaky dermatitis. Next is marasmic kwashiorkor. This is a combination of both marasmus and kwashiorkor, where there is severe wasting as in marasmus, along with edema as seen in kwashiorkor. Symptoms are children exhibit signs of both severe wasting and edema, making it a particularly critical condition. To understand further the differences, I have included this table. Causes of marasmus: calorie and protein deficiency. Kwashiorkor, primarily protein deficiency. Age group affected for marasmus is common in infants and very young children. For kwashiorkor is typically in older infants and young children 1 to 5 years after weaning. Body appearance in marasmus emaciated with severe muscle and fat wasting. In kwashiorkor is edematous swelling, especially in limbs and face, rounded belly. Weight loss in marasmus, severe and noticeable weight loss. In kwashiorkor, not always noticeable due to edema. Muscle wasting. In marasmus, there is severe muscle wasting and fat wasting. In kwashiorkor, it is less prominent due to edema masking it. Edema or swelling is absent in marasmus. Kwashiorkor, it is present especially in feet, legs, face, and abdomen. Skin changes in marasmus is skin is dry and wrinkled due to fat loss. In kwashiorkor, skin is dark, flaky, and peeling skin. Hair changes. In marasmus, hair is thin but less likely to change color. In kwashiorkor, hair is brittle, thin, and maroon reddish. In marasmus, appetite, good appetite, but limited access to food. In kwashiorkor, there is poor appetite. Behavior. In marasmus, often alert and active despite emaciation. In kwashiorkor, there is irritability and apathy. Associated deficiencies in marasmus, less commonly associated with specific deficiencies, but overall malnutrition. In kwashiorkor, often associated with vitamin and mineral deficiencies such as iron, zinc. In marasmus, mortality rate is moderate if untreated but still serious. Kwashiorkor, high due to susceptibility to infections. Recovery. Marasmus may recover with adequate calorie intake and gradual refeeding. In Kwashiorkor, it often requires therapeutic refeeding and close monitoring for complications. Let's dive further into diagnosis. It's based on weight for age, height for age, and weight for height measurements. I used to evaluate malnutrition severity. Laboratory tests. Blood tests may reveal low albumin levels, electrolyte imbalances, anemia, and immune deficiencies. Body mass index for age and sex-specific percentiles helps assess underweight or wasting in children. Clinical observations. Symptoms such as muscle wasting, edema, and skin changes aid in identifying Kwashiorkor and marasmus. We will see the treatment aspects. First and foremost is hospitalization, where the therapeutic feeding and medical care are given. Next is therapeutic foods such as RUFT, ready-to-use therapeutic foods like plum peanut. It is a nutrient-rich peanut paste fortified with proteins, vitamins, and minerals. Can be consumed directly from the packet without refrigeration or preparation. Used in community-based malnutrition treatment programs, reducing the need for hospitalization. Then the method is hydration and electrolyte imbalance. Fourth is antibiotics and medications. Antibiotics are often administered to manage infections that can worsen malnutrition. Fifth is dietary intervention and rehabilitation through vitamins and mineral supplements. Sixth is public health interventions, which include various national and international programs of pregnancy and child health care. These are some of the main international and national health programs for protein energy malnutrition. World Food Programme WFP from United Nations, UNICEF's nutrition programs, Scaling Up Nutrition, Sun Movement, Midday Meal Scheme MTMS, Portion Abhiyan, National Nutrition Mission India, Supplementary Nutrition Program SNP in various countries. This is a graph showing the average death due to protein energy malnutrition according to various countries. Protein energy malnutrition is a serious global issue, but it is preventable. By practicing conscious eating, choosing balanced, nutritious meals, we can take care of our own health. At the same time, let's be aware of those in need and contribute in any way we can, whether by reducing food waste, supporting nutrition programs, or spreading awareness. Thank you.